With this, the South African National Blood Service has conducted tests in 4 provinces. They show a large percentage of the population has likely already been infected with SARS-CoV-2. The study was published on Friday and was led by authors from the National Blood Services. So for more on this, we're joined now by Karen van den Berg, a lead consultant to translational research at the South African National Blood Service. Karen, thanks a lot for joining us this evening. Let's talk a little bit about the study because it shows that a large percentage of the population has likely already been infected with the coronavirus. So take us through some of the other findings.
So thank you very much for having us, Faith. I think the work that we've done at the South African National Blood Service has confirmed what I think a large number of researchers in this field have already suspected. And that is that amongst our black population especially, the prevalence of SARS-CoV-2 antibodies is quite high. In fact, in the Eastern Cape, we have estimated that that is likely sitting at about 60% already. Sure. And this, I think, contributes to or adds to the information that is already available that some of the other groups that have been investigating this, such as the NICD, as well as the Western Cape Department of Health, have been doing. I think what is really good about the research that we've been able to do is that the population that we looked at is slightly different to that which have been investigated before, in that the donor population represents a different sector of the population. So generally our donors are from the middle class. We have a wide representation from all classes of our population, and we collect blood both from the urban and rural areas. So we were able to really get a good sense of what is happening across the board in these 4 provinces that we did investigate.
Karen, I want to stay on your point about antibodies, because the studies say that black people were between 3 and 5 times more likely than white people to have antibodies to the virus. Why are there such striking differences in prevalence between blacks and whites?
So obviously, it's not anything related specifically to race, but we think, and obviously one needs to go and investigate this further, but in our opinion, this is really a legacy of the different socioeconomic situation of the different populations in South Africa. So really this is a legacy of the past. We know that predominantly our poor people in South Africa are people of color, particularly of black people. So these people have extremely limited resources, not only to protect themselves from COVID, so many of our informal settlements have no running water, very difficult to separate yourself or socially distance when you are packed into townships. But also, in addition, these are our people that perform work such as in the grocery stores and places like that, where people are forced to go out to work, whereas opposed to being able to work from home, or being able to work in circumstances where you can socially distance. And in addition, I think the underestimation in other studies of how far the COVID epidemic has actually infiltrated in our black communities has a lot to do with the fact that those communities also don't have the resources to access healthcare and get themselves tested. And so this is really a combination of significant lack of resources amongst that population group, not only to protect themselves, but also to seek healthcare when needed.
Yeah. But then what does that say, Karen, about the rate of transmissions? I mean, we see now that transmissions are said to be on the decrease. However, if about 63% of people in the Eastern Cape have since been infected, 32% in the Northern Cape, 46% in Free State, and 52% in SAN in KwaZulu-Natal, can we really say that the reports that we're getting and the figures are really a real reflection of the number of people being infected, particularly on a daily basis?
So I think this is exactly the importance of the study that we have performed, is that the people who are reported, for example, through the really brilliant work that is being done by the NICD, are people who have either access to go and have themselves tested, or because of the fact that they are so sick that they get admitted into hospital. So there's a large proportion of people who may be infected, who have mild symptoms, And depending if you have a medical aid, you may get yourself tested. But if you don't, then likely you won't get tested. And so I think this is where our study adds value. I don't think that ours is better or worse, but I think it adds a different layer. And I think what is really good about the work that we do is how easily it is for us, or how easily we can perform this kind of research, where we can go into large sections of the community and do large volume testing quite rapidly.
Yeah. Any findings on the new variant of the virus?
So that kind of research I leave to our colleagues at the NICD and others that have done really brilliant work on this. I think for us, these really high prevalences was quite surprising, considering the fact that, and I think this is really important to note for our donors out there, that we have a deferral period for people who either have had COVID or who are exhibiting symptoms of COVID. And so they have to wait at least 14 days before they can come and donate. And this is obviously to ensure that our blood supplies remain safe. We want to protect our donors, our staff, and our patients. But this does suggest that a lot of the people who tested positive probably had been infected already prior to the second wave. And so we are busy with further work that we are contacting these donors that have tested positive and others who have tested negative, and trying to better understand what this actually means, because it's one thing to see that 60% of the population or certain sections of the population now already have SARS-CoV-2 antibodies. It's a completely different thing to be able to understand what that means in the context of this new variant that has swept through South Africa.
Karen, we'll have to leave it there for this evening. Karen van den Berg, lead consultant translation research at the South African National Blood Service.